I'm Dr. Ash Parmar, and I'm one of the clinician engagement leads at PortmanDentex. This Fireside series of webinars will showcase some of the top clinicians we have at PortmanDentex and allow you to listen into their expertise from the comfort of your own homes. Each webinar is also sponsored, and tonight we're delighted that the sponsor is Boutique Whitening. Boutique Whitening are the leading whitening brand in the UK and being available in almost 60% of practices in the UK. We're thrilled that they're also an approved brand with PortmanDentex. And if you're lucky to be in a PortmanDentex practice, you can avail from a special offer that they're doing at the moment, with kits available from just £19.50 and kits including S4S whitening trays available from £51.40. If you want to order kits for your colleagues, I'm sure you want to avail from this fantastic offer. Those are available at £35. So some amazing offers, and again, thank you to Boutique Whitening for sponsoring tonight. So now on to our esteemed speaker, and I'm sure someone who requires no real introduction, Dr. Ash Parmar. Ash was the founder of the unique and state-of-the-art dental referral centre, Smile Designed by Ash in Chigwell, Essex, which is now part of PortmanDentex. He's an inspirational, knowledgeable, and well-respected dental educator, having lectured internationally. Through his training academy, the Academy by Ash, Ash has trained hundreds of dentists in cosmetic dentistry, smile makeovers, and occlusion. He's been extensively featured on TV in shows such as Extreme Makeover UK, This Morning, Body Shockers, and the show where I'm sure many of you will remember him best from, The Only Way is Essex. I'm sure you all agree that is quite an extraordinary resume. So without further ado, I'll hand over Dr. Ash Parmar, everybody.
Thank you so much, Asad. I'm just going to put my screen up. Great. So thank you very much for PortmanDentex. It's an honor to do this first presentation. And the title that we've come up with is 10 top tips to become a successful cosmetic dentist. So if you have any questions, then you're more than welcome to put it in the Q&A, and we can find some time at the end just to go through that with everyone. So, I mean, I've been a dentist for 33 years now. I qualified at Guy's Hospital, and you know, this practice that we set up was done about 15 years ago. And we sold to Portman Dental 2.5 years ago, and part of this great team that we have. And like I said, it's really an honor to share some information with you tonight. So why stay for this webinar? Why actually come for this webinar? I'd like to give lots of tips on the fundamentals, things that you're really not taught at uni, like, you know, before the patient comes in, and some business ideas. So they're the fundamentals. And then to do cosmetic dentistry, you have to attract the right type of patients. So, you know, marketing becomes really important. Yeah, I know in Portman you have support from a marketing team there, but it's really important to have a philosophy and a budget in mind. And then when your new patient comes, whether it's an NHS patient, a dental plan, private patient, you know, how is your experience for that new patient? You know, how are they going to be looked after by your team members? And then in cosmetic dentistry, communication becomes so important. Communication between you and the patient, and between you and the dental laboratory. Because errors can occur if you actually misunderstand what the patient wants, and also don't effectively communicate the information to the technician. And then obviously you need the clinical skills, as with any field. I mean, if you do braces, if you do implants, you know, Botox, anything, you've got to really be competent clinically to do the good job. And then you need the right equipment and materials, because without the right stuff, you can't do the job properly. So taking shortcuts in that area, I don't think will help. Okay, so 10 tips. Let's go through them one by one. I'd like to start off with this one. It's all about setting your vision and your goals. I appreciate that there's a global vision for PortmanDentex, but I think even within your own frame of your practice, you should really have an ethos and a philosophy of what's important to you and your team. So this is our practice. In the middle, you can see this is our relaxation area. We have a nice consultation room. And on the right, you can see a makeover photo done for one of my patients. So one of the fundamentals of being successful, I think, is to become a better leader yourself. And what you need to remember is when you point the finger at someone, three fingers are pointing at yourself. So, if you blame someone, then you've got to really question, how is your conduct? What is your, how are you setting an example in the practice? So leadership is so important. When I've been coached by some of the best business coaches in the USA, and Bill Blackford was one of them. We made a heavy investment in learning from him. And I remember one of the best things I learned from him is how to become a better leader and how to communicate effectively and sell in a sort of ethical, non-pressurized manner. So read a book on leadership, get inspired by successful leaders in business, and inspire others within your own practice. You then need to have a vision. And in this vision, you need to be very clear about three important things. Who are you as a practice? What do you want to do? And for whom? What is your target audience? Which type of patients you want? And then we were talking earlier on, and I said that, to become successful takes a lot of hard work. It takes a laser sharp focus, and it takes hard work, especially in this modern day and age where we're finding a lot of patients going abroad for tourism, dentistry, Turkey, places like that. And also there is competition, so after COVID, the economic situation of recent last year or two has changed, and people are finding it more difficult to go for higher end dentistry. And then the other important thing, I think, is have written goals. So the most successful people on the planet have proper written goals on a simple A4 sheet of paper. You can have goals in different departments, like your personal goals, your professional goals, your personal development concepts, how much time you want off, your financial income you want, where you want to be in 6 months, 1 year, 3 years, 5 years, you see? But actually writing goals down will really help you to focus much better. And then you can review and monitor and track your goals, see where you're heading. So those are some basic concepts which we can explore in greater depth. But today, like I said, I'm just going to go through an overview of these 10 tips. The second important thing, which is huge, I think, is your team. You cannot become successful without having a fantastic team. A team, staff who are committed and who are passionate and dedicated to following your vision and your goals. So when we first started the practice, this was my team that we started with. And again, I think, you can have a beautiful looking practice, but if you don't then have the right uniforms, the smiling, courteous, welcoming staff members, and, being professional and caring all the time, then people will sense that. Everyone's got a sixth sense. You can't really fool someone about customer care. And my philosophy always is trying to go the extra mile. Try and create what's called raving fans. There's a lovely book called Raving Fans. If you haven't read it, please buy it, read it, get it for your team members, and share this information with your team. What are the small touches that you could do to go the extra mile for your patients? That's really important to debate as a team. There's a fantastic book called Good to Great, and this is a book by an author called Jim Collins. And what he did is he studied lots of businesses many years ago, and he looked at a really successful business. Say if you look at Walmart in America, and there was when they started, that wasn't doing as well, and there was another comparative business. And then he tracked it and saw the business 5, 10, 15 years later, and one had shot up sky high and one just stayed where it is. He then followed all 15 comparisons, and then he analyzed what was the common threads in all these. So this is one of my favorite quotes from that book. Get the right people on the bus first, and then get the wrong people off the bus. So if you have a team member that is sort of letting the team down or causing problems, then the energy won't be right in your practice. And then you have to think, actually, where is everyone within the bus? So maybe you had a fantastic nurse who had so much potential that she could become your treatment coordinator. You may have actually looked at that as an option. So then seat the right people in the right seats, and then decide where to drive the bus. So the vision comes a little bit later. You have to have the right team first. Otherwise, you'll be stalling all the time going forward on your journey. Staff, there are two important things. They need to be appreciated. And appreciation can come in two ways. One is saying well done at the right time. So there's a fantastic book by this author called Ken Blanchard. It's called Well Done. And it's a beautiful little book. And it shows you, it's great for managers, I think, and even as a principal or lead dentist in your practice, you can read this book and really understand how to appreciate people. So this should come from the heart. It should be done fairly immediately once someone has done something good. And that means a lot to people. Different team members will be motivated by different things. For some people, this appreciation bit is so much important. Other team members, they may be more financially driven. So you just have to really understand what makes everyone tick and reciprocate and focus on that and create a system which helps your team. I know PortmanDentex have a nice bonus system. They've announced this other recent concept for additional funding for the social budget, which is all a good move to help bring your team together and feel appreciated as a team. So, have your vision, goals, have that focus, then make sure you've got the right team, and then think about marketing. What are you going to do, right? So in marketing, you first have to decide who is your target audience. So our practice is called Smile Design by Ash. Our positioning statement is called Feel Good Dentistry. It's a very emotive description there. It's not about veneers, it's not about implants. It's about making people look good and feel good. As we all know, when you look good, you feel good. So my perfect patient for me as a dentist is maybe the 50 to 55-year-old and over patients. So to me, that's the perfect patient. Why? Women especially very often put everyone else first. They're married, they look after the children, they'll look after the husband, they'll do the housework, they put themselves last. There sometimes comes a milestone age, or maybe their daughter's getting married, and suddenly they want to look good for themselves. Patients also, as they get older, will have gaps between teeth, they'll have worn down teeth, they'll have darker teeth, they'll have missing teeth, looser teeth. All these problems relate to more complex situations, and therefore the treatment is more comprehensive. So for me, that sort of older population who may have more problems and more need, and also perhaps more financial income because they've got more disposable income at that point in their life, that's my perfect patient for me. Where we live in Chegwell, it's obviously an area where everyone wants to look great and designer clothes, and you've got the younger yummy mummies that also turn up in the Louis Vuitton handbag and want a beautiful smile. So this is the other target audience we have that we're looking at. So within your own area, within your own practice, you have to begin to think in your marketing strategy, who are you trying to attract? Because maybe this older target audience, they may not be so familiar with Instagram. Certainly this younger group will want to look on Instagram. So, the type of marketing you do is dictated by who you're trying to attract. Like I said, in our practice, we're fortunate. We have a number of celebrity patients. This is Michelle Keegan, Mark Pride. And, historically, we've been fortunate to have attracted these type of patients. As Asad said, I'm fortunate in years 2005 onwards. I was one of the most featured dentists on TV on various media and newspapers and things. So that also adds the weight and the credibility in your marketing strategy. And any one of you, if you ever have an opportunity to go on local media, TV, whatever, take it, because one thing will lead to another and more opportunities will definitely come your way. So in summary, these are patients I've treated in my own practice. So the top left two patients are big implant cases. The guy on the right was a big competition that we did, and he won a smile makeover, and he's now really happy with his smile. So basically, my suggestion to you for marketing is work with Portman, have a proper plan. So at the start of the year, at the start of your sort of financial year, sit down with the Portman marketing team and work out a proper plan. And historically, what I used to always look at is you try and focus and budget for 3 to 5% of your annual turnover towards marketing spend. And then track your results as months go on, but before the end of the year is out, definitely track what has worked well, what is not working well. In our practice, the personal word of mouth is so important. Giving patient gifts for referrals. Portman have done a fantastic £50 M&S voucher. So if someone refers someone, then they'll get a voucher and someone else will get a voucher. So small incentives and things like this can really be appreciated by people. So that word of mouth, doing beautiful dentistry, And appreciation gifts is, I think, the most powerful way. And obviously, there's having a fantastic website. There's online and offline marketing. I'm a firm believer in having a lot of printed material and brochures. So we've created a whole range of fantastic brochures with the Portman team about 2 years ago. So they're all in use. And yeah, just being very sort of professional about the whole thing, that all helps. Yeah, but track your results, work out what's working well and what's not working well, make changes. You know, you don't have to stick to one thing. So that was just a little brief thing on marketing. Obviously, I can talk 2 hours on that subject alone, but let's move on now to the new patient experience. Okay, so the way I'd like to compare it is one of our favorite holidays. So our daughter's 22, our son is now 19, but one of their favorite places or hotels to live in the world where we've been traveling to is the Wing Hotel in Las Vegas. So why do they like to go to the Wing Hotel in Las Vegas, you may ask? We don't gamble, but the first important thing is your experience. How are you made to feel? The minute you walk in, there's a beautiful smell. I think they pump oxygen into the atmosphere, so that'll make people gamble more. The ambience is just stunning. I mean, there are flowers and all the different shops are just beautifully done. So you just feel good straight away when you walk in. They also engage all the senses. They're engaging the visual sense and making you everything look really nice. They have a beautiful smell around, so that smell sense is engaged nicely. When you have any food or drink at the restaurant, it's beautifully presented, so that's also nice. And when you smell it, it smells nice. So really, and the music is nice. So in every way, they're engaging the senses and making that experience feel good. Yeah. And the first impressions are really important. Research shows, and there's books you can read, where business is done within the first 3 seconds when you meet someone. So the first impressions are so important. Okay. One of my mantras in the last year or so to my team in PortmanDentex is everything matters. And I mean it. So what that means is the minute the phone call is taken, the way they walk in, the way they're greeted, all that has to be done properly. You know, people will spot if there's any glitches in the system. And what you want to do, as I mentioned earlier on, is create raving fans. The reason there's so many other beautiful hotels in Las Vegas, but I would not go anywhere else except stay at the Wynn Hotel because the rooms are stunning with all the gadgets and things. The service is good and I feel good. And, you know, even if you pay a little bit more, it's that experience. And when you relate that to your dental practice, this is what happens when patients come to our practice. You know, we want to welcome them. The treatment coordinator or your reception staff member should really welcome them with a nice handshake and eye contact and a smile. Your ambience is nice, so they feel good. And really, a big tip I'd like to share with you is every patient, just tell your team, make them feel like a guest in your house. So if I come to your house, I said as a guest, you make me feel welcome. You'll make me probably a nice cup of tea, welcome me, show me around, let me sit down nicely, we'll have a nice chat. So similarly, when patients come to your practice, even if it's an NHS patient, make them feel like a guest within your practice. Just that mood or that way of thinking will really enhance the way your team look after your patients. And then you've heard of this word treatment coordinator. In my opinion, that is the pivotal role in any dental private high-end practice, because what happens is the patient is given a practice tour, and then the treatment coordinator will do the interview with that patient, ideally in a consultation room in a private environment. Because we have a fantastic new patient cheat sheet where we ask the question in a very emotional way, working on the right side of the brain. And when you go through these concepts, you often bring the patients to tears because you go to the root cause of what's bugging them and why they want their smile or whatever. So that questioning interview process is so important, and that has to be in a private environment. You can't do that in like a busy reception area. It's not going to work. Nor should you do it in the treatment room, ideally, because you're really locking out that important surgery use, because the dentist's hourly rate will be higher. So once the patient is excited, the dentist is introduced, they can't come and say hello, they'll prepay for the full assessment fee, and if they need a smile makeover or more comprehensive treatment, they'll be booked in for another hour and a half for the full assessment appointment, and I'll take all the diagnostic data in the room, and that's a really important, powerful appointment because you're building a lot of trust in that patient, the trust and the confidence, okay? And then what we tend to do for our bigger cases is we invite the patient back in 1 week later. 1 week later, this is the options meeting or the case presentation appointment. And what's happening is that we're going back into the consultation room. We have a beautiful PowerPoint created, customized for that patient, and we present to that patient in a perfect manner what their problems are and the diagnosis and then the solutions and how we would like to help them. I've got a massive range of before and after cases with a lot of makeover shots. So whether it's a younger, older patient, whether it's someone with gaps, worn down teeth, crooked teeth, we can show a similar case like that patient's before and after, and that really gets the patient emotionally engaged. And therefore, if you follow the whole system and your team is switched on, I have found that our case acceptance is nearly 90%. So if you follow the system, your case acceptance should be high, even for big treatment plans. Okay, so that was just a little bit about how to have that new patient sort of journey and you know how we can do it. Now you may be saying, okay, our practice doesn't look as nice as yours, Ash, or you know, our staff maybe don't know what to say. But to be honest, guys, everything can be learned. You know, there are plenty of good teachers in the dental industry. Even if you're an associate in your practice, you can actually improve your own room. You know, you can go and paint it at the weekend yourself. You can make it clutter-free. You can you know put some the plant or something. You can have some aromatherapy. You can have a family photograph. So all these things will make you more homely, or you don't have to spend a lot of money. Yeah, but try and get you and your nurse and your treatment coordinator to all be really focused on customer service. Okay, tip number 5 on how to be a successful cosmetic dentist. Remember, if you have questions, pop them in the chat and I'll be happy to, in the Q&A actually, and then we'll be covering those at the end, okay? So let's talk a little bit about now on communication, and I want to give you my best pearls on how to sell and get case acceptance for big cases, okay? So let's share some information on these topics. So starting with communication and selling. The most powerful sentence I can share with you is be interested and not interesting. Now, what do I mean by that? So when you meet someone, right, I can either give it the big one that, you know, I'm this dentist and I've got my academy and, you know, I've been on extreme maker and all this stuff. But that is me sort of being interesting. It's not really good because I'm talking about myself. What's much better is to ask open-ended questions and be interested in the patient. So how may we help you? How long has this been bothering you? What have you done before that's worked? You know, how does this affect you? Tell me about your mom and dad. How did they suffer? All right. On a scale of 0 to 10, how would you rate your smile? Okay. You know, what would it mean to you to have a beautiful smile like the one I just showed you? You know, you're getting married in 3 months' time. I know you're embarrassed. What would it mean to walk down that aisle and have a fantastic smile? So be interested, ask a lot of questions, make notes, build up a social history. I love to really get to know the patient first before I dive in and start talking about teeth, because once you build up that rapport and you've got that sort of relationship going, then people will highly likely buy from you. Remember, people will buy from you if they like you and they trust you, okay? So build a relationship. This takes time, guys. What you need to understand is that this is why it's so good to have a staff member doing that initial interview on your behalf, so they can really build a rapport on behalf of the practice. A staff member can say positive things about me, and that's more humbling rather than me saying anything big about myself. So, you know, that's the other advantage. Your staff can positively promote the dentist, they can promote the team, they can talk about the benefits of the practice, and they're building a lovely relationship and documenting all these things on your computer. So this takes time, and really the reason you need to find a variety of time for this initial interview is because you need to understand about the personality types. There's something called the DISC profile system. I'm pretty sure that a lot of dentists would not know that much about this, because normally when I'm lecturing or ask the audience, few people know, but not that many. But I would suggest you that this is one of the most important things to learn. So Google it, read up a book or two on it, find out more about the DISC personality profile so you understand how to handle patients. So as a quick example, if I had Alan Sugar come to my practice, he's a D character. He's a dominant person. He's business-minded, no nonsense, get on with it, short conversation, I'm going to take care of you. It'll be painless. You're my PA. I'll make sure your PA organizing your appointments with my secretary. Do you have any other questions? Bang, that's finished. That conversation doesn't need to last anymore. Contrast that to a C character, This is someone who likes information. They want to really ask you a million questions. They want to take their time about it. They'll go home and think about whether they're going to have this done. They want to ask what their family think. And sometimes you need patience for that type of patient. And it's important to recognize really from the first phone call, when a new patient phone call comes, your staff need to be trained to understand the different disc personalities so that they can book in the right amount of time when the patient first visits the practice for that initial interview and the patient. This is crucial as a team, you understand. I am almost like a chameleon when it comes to marketing and discussions with our patient. I'll adapt the way I talk, like, I'll slow down, I'll speed up, I'll give someone more compliments, all these type of things you have to do depending on the personality type. Now, if you said to me, Ash, can you summarize selling in one sentence, then this would be it. Hit the hot button and overcome their objections. So what do I mean by hot button? A new patient may come to you for different reasons. Someone may be an engineer. So for that person, structure, function, getting their teeth replaced and being strong is important. Someone else is really aesthetically driven and they want a beautiful smile. So looks is the most important thing. They may not even be cleaning their teeth well. They don't care about flossing and gum health, but they want that hot looking smile. So everyone's different. Some people may be scared or worried. So you've got to find out what is the driving, motivating factor for that person and focus on that. People then have reasons why they don't want to go ahead with stuff. So you need to find out what is their objections, and then you have to help them overcome that objection. As we're all familiar, the most common objection is fear or pain. People are scared of injections, drilling, bad experience when they were young, the gas thing, dentist was a butcher, all this rubbish we keep hearing, right? So you have to make them feel, you have to be empathetic, you have to come on their side and tell them it won't be like this in your practice. So overcome their objections. Do the first bit painlessly. If someone's a huge case, sometimes just taking that loose tooth out and giving that first injection painlessly, even if it could be a 5-minute extraction, but allow half an hour for that appointment and do that first bit so well that they will think you're a dental god. And then they will trust you from that moment onwards and not go anywhere else or see any other dentist. When you sell, keep it very simple. Keep it simple and stupid. Don't talk a dental jargon and keep it very visual. So I love photography. I love showing them their own pictures. A lot of us have got 3D scanners. So one of the most powerful uses of 3D scans, I think, apart from communicating with the lab and getting things made, is to show them the 3D scan. You can click around, rotate it, show them various problems, broken teeth, over-erupted teeth, lack of teeth, abfraction, failing amalgams, gum disease. All these things are very visual. They'll own the problem. When they see it, they own the problem. Patients are often shocked what the state of their mouth is when you show them the retracted view on a big screen. So I think this is a very powerful way. You need to be very good with photography to actually sell and also communicate well with your technician. A really important word to learn is something called co-discovery. Co-discovery. What this means is that you let the patient see and comment and make an understanding of what's going on. You don't, like, for example, if I'm discussing with someone how many veneers they need, right? I'll give them the mirror, ask them to smile. I'll say, okay, Julie, tell me, how many teeth can you see? I'll ask them to count. 1, 2, 3, 4. Okay, you've got a narrow smile, they're coming in. How many can you see? 4 here, 4 here. So they've counted 8 teeth and they're telling me. So rather than me saying, you need 8 porcelain veneers, they're co-discovering with me what's needed. So our assessment protocol is one of the most comprehensive assessment protocols in the UK. It's almost like a 23-page document. And all the wording in is very carefully designed. So my nurse is calling out, okay, how much, so if you're on a gum disease section, she'll say, how much harmful plaque and tartar is there? Okay, so a little bit, medium, low. Is there any evidence of bad breath? Okay, how many deep gum pockets are there? Are there any loose teeth? Are there any rough fillings or broken teeth which are attracting plaque? So all these things are questions which my nurse is calling out. I'm answering her, she's recording it, and we're doing what's called co-discovery. So not only are you co-discovering visually using photos and the 3D scans and study models, but you're also co-discovering verbally by them listening to what's happening during that conversation. Let them own the problems, and then the onus or incentive to have the treatment will be much higher. Okay. Another huge tip is talk about benefits and not features. A lot of young associates in enthusiasm will talk all about features. Right, this is going to be a zirconia crown, and I'm using 5 magnification loops, and I'm doing this. Patients don't care. That's like your problem, right? Talk words like this is smooth, this is strong, this is aesthetic, this is natural, this is long lasting. These are the sort of words that they want to hear. Okay, so whenever you talk and have conversations, talk about benefits. And as I said earlier on, to get a sale to occur, they must trust you and they must like you. And by doing this co-discovery and the comprehensive dental assessment, they will definitely trust you more. Yeah. So that's a little bit about that sort of way to sell ethically. Now let's talk about how to communicate. Ladies, if you buy a nice dress or clothes, it's very easy if you don't like it to send it back. Okay, this ASOS and all this rubbish posted things. I know my wife sent me to post office to send the parcels back. Very easy and quick to send it back. All right. If someone's going to be spending money with you and they're going to give you permission to touch their teeth and do something, they really want to see how they're going to look before they have something done. That's for sure. That's one of the objections or fear factors about having treatment. And these are some cool ways in which I use to communicate smiles to people to sell them. By far, my most favorite way is what I call direct mock-ups. This instrument, guys, here is a Hugh-Feely instrument. The code is TNCCIB. It is my favorite instrument on the planet. The best composite for sure for doing mock-ups in my hands is Empress Direct Bleach Light Dentine. I have syringes of this. So in this case, what I've done is an arrow smile, a gummy smile. I took composite and this instrument freehand without any wax-ups, and I created this mock-up in about 12 to 15 minutes freehand. And you can learn these skills and do something like this. Then what you do is take photographs of this, you take a video of this, you also use the patient's own phone, iPhone or Samsung, and take photos and a video on their own phone. So they'll be shocked. They'll see this and they'll see this as a mock-up, and then you take one by one off once you've taken the alginate and all the measurements, and then sometimes I leave half of them off, half of them keep on, half off. Take another picture on their iPhone. They'll be shocked as to how they're looking. So one of the benefits of mock-ups directly is it's a selling tool. It's a communication tool. Now, the massive advantage is that by doing the mock-ups, I really get a feel for where I'm taking this case. I can create all the aesthetic parameters, get the buccal width, the buccal corridor to the correct width, incisor ledge position. Everything can be honed in so that my wax-ups that are delivered from the technician can be superb. All these individual pieces I'll flick off and send to the technician with an Ivanson gauge that can measure. So my wax-ups are aesthetically and functionally perfect. I use a digital caliper and we measure from the incisor ledge to CJ to 1/100th of a millimeter. So this is the level of accuracy we work to. You can also do cosmetic imaging. There's a software called smileimaging.co.uk. A lady called Tracy that has his business. She's based in Cyprus. So this sort of cosmetic imaging can be done by one of your staff members within 5 or 6 minutes. This is anatomically correctly positioned. The shapes are good. Color can be made natural. So again, this is a great tool you can use to show your patients how this smile might look. The third way, guys, is you can get some wax subs done. So you let's take some records, get your technician to do some additive technique wax subs. They'll make a putty index with a nice putty. And then you use this material called Luxatemp, the color Bleach Light BL, and you syringe some of this material into the putty, dry the teeth straight in the mouth, 3 minutes. Don't even put any etch, nothing in there. As soon as you take it off, the first word you hear there says, wow. You then just use a Mitchell trimmer, flick off the excess, show the patient in the mirror, and they literally will be wowed. So this thing, there's obviously some cost involved with the wax ups. So I personally prefer the direct mock-ups initially, and the wax ups will come later once the patient has gone ahead with the treatment. And then some people are very technically minded and they want to use a computer. So obviously Christian Coachman is a world-leading authority on teaching a digital smile design, and this can be done. But I personally prefer these more traditional techniques because with a digital ruler, you cannot measure to hundredths of a millimeter, whereas when I've done something live in the mouth, my measurement accuracy is going to be super high. Okay, so that was a little section all about selling and communication. Now, to become a good cosmetic dentist, whether it's the realms of orthodontics, implants, cosmetic dentistry, composite bonding, whatever, you need to understand this slide. What is the end goal? What constitutes a great smile? So if you've got screen share, or if you want to take a snapshot, take pictures of any of the slides I'm doing. But here, you're seeing various important things. This midline is right in the middle. Okay, it shouldn't be canted. The zenith position, this little tip here, the central and the canine are equal. The lateral incisor is about 0.5 to 1 millimeter shorter. The central should be vertical. As you go distally, there's a 5-degree taper. And then there's the width, the golden proportion. So here there's a ratio between the central, the lateral, and canine, which is actually 1.6, 1.0, and 0.3. The average central incisor is about 11 millimeters high, and the width is about 8.5 millimeters. The edges of the teeth should be parallel to the lower lip. Okay, the embrasures are small here, get a little bit bigger, get a little bit bigger here. By the time you get to the premolar, it's almost right angles. Okay, the gum lines, the zenith here also should be slightly distal for the central to the middle of the tooth, and the lateral can be either in the middle or slightly distal, and the canine slightly distal. So by understanding all these zenith position things, that's where lasers come in. So we use lasers to improve the gum lines properly. As an example, this was the case before. Gummy smile, so we used water lace. We did osseous crown lengthening. So I didn't refer the patient to periodontist. We did surgical crown lengthening, osseous bone removal with the laser without raising a flap. So I can do the gingivectomy. Then I can turn the laser tip vertically and take 2 millimeters of bone away to recreate the biologic width. Once things are all healed up, after 2 weeks, we can take the wax up records, and then we moved on to natural porcelain veneers here. And this is the patient before. This is the same patient afterwards. Okay. So to achieve a high standard like the case I've just shown you, and to start doing these whole cases, you need the clinical skills. Okay. So some of you may enjoy cooking. So why have I put this slide up? What's it to do with dentistry? Imagine you went to a Michelin star restaurant and you had an unbelievable meal, something really special, okay? Let's think about what the chef had to do. He first had to source all the best ingredients, fresh, organic food for you, okay? He then had to cook it in a certain way, like, you know, what went in the pan first, what temperature was it, how did the condiments go in, which spices did he use, you know, and all that flavors and everything is then done properly. He then presented the food in a certain way and dressed it with the right sauces and everything. So to create the perfect dish does take a lot of effort, sequencing, and doing each step perfectly rather than cutting corners. Okay? And in a similar way, to create the most perfect smiles needs careful planning, needs a strategic, step-by-step mechanism of everything. How to do the preps, how to do the trial smile, how to do the review, how to do the cementation, how to do the aftercare review using T-scan, getting the occlusion right, okay? So how do people learn the best? You could ask that question. If I want to become very good at something like implants or smile makers, how am I going to get really, really good at that? There's a guy called Edgar Dell, they've done research. If you read something, like if I do an article for you and you read it, 2 weeks later, you will only remember 10% what you read. As you know, if you read a book, I'm really forgetful. Like by the time 2 months have gone by, I can't remember much of the book or whatever you read. If you hear something, like hearing my words right now, you may remember 20% of what you hear. If you look at pictures, I'm showing you visuals there. Hopefully you might remember 30%. And then if you watch a movie, take part in a demonstration, seeing it done on location, if you see and hear and take part, 50%. The best way, guys, is when you do something live yourself. You know, if you've done an implant course, a residential course for a week, and then at the end of that week, when you first make that incision and place your own implant with your demonstrator sat next to you, and you do that thing properly, the feeling at the end of that is like you're on a sky high. Okay? Similarly, what my strength is, or what I'm well known for, is hands-on training, hands-on courses. So there's a signature 8-day course that I run. It's the Aesthetic, Restorative, and Occlusion course at my practice. We normally commence that in June and end it in sort of November time. And each year we have 6 dentists, only 6 dentists that treat a patient. So this is a lovely dentist called Panita. She came from South London. She wanted to treat her dad. This was a rare case. So she'd never done that before. So we did the upper smile in the practice, and then she did the lowers on her own. But, you know, this is a cementation day. So she's doing everything. I'm just like support mechanism being there for her. On this course, we go through the A to Z of everything. We provide all the materials. It is a world-class course. And this is the emotional feeling. This is the father at the end. He wanted a very natural smile. He wanted too white. But he had tears in his eyes when he realized what his daughter had done for him. Okay? So the way to learn, as I said to you, the best way, I think, is hands-on training. So tip number 8 of my 10 tips, equipment and materials. So this is a burr kit that I've created many years ago with a company called Westwine. The burrs are Comet. There's a German burr, so I've got no financial interest in this at all. But this kit is just unbelievable. There's a precise reason for each of these burrs. This, I think, is the best porcelain veneer prep burr in the world. It's got a 20 micron tip here. So every single thing here has got a precise reason why I have it here. And this is very, very good for me for my treatments. If you haven't gone into lasers, then you really should. I mean, for me, laser dentistry, a laser is as important as a fast handpiece for me. Because if you look at this case here, okay, uneven gum lines, thin upper lip, if you just change these front 4 old V&K crowns and put new ones in, and if you don't correct the gum lines, the smile won't look good. Okay, how else are you going to trim the gum away? Are you going to cut it with a burr? Are you going to cut it with a knife? Are you going to use electrosurgery? You know, when you start looking back at your cases when you didn't get the gum lines right, you feel bad about why you didn't do that. So to create beautiful work like this, you can use a soft tissue dyed laser to do small changes. And then we've also got a water laser to do the osteospinal thing for bigger changes. Face pose, there's different face pose. The Coist facial analyzer is my favorite. So for mini makeovers and small makeovers, 4 to 8 units, this is what I use. I've also got the Dana face pose for my bigger wear cases. I use the DMG materials largely. So my best bite material of choice is O-Bite, which is a fantastic material. We've got the digital scanner, we've got the Trio scanner, but still on my big cases, we do analog impressions. I use the honeycomb rigid fast with a putty and cling film. This is a putty knife. We use the honeycomb light. We need 2 guns, one with a small tip. And we use a single retraction core technique with race stripped-in solution. And by doing a 2-stage, you're going to get amazing results like this. Fantastic impressions. And once the impression is perfect, then your technician can make a perfect model, and you're going to get a nicely fitting work. As I said to you, every stage has got systems involved. If you want to create the perfect trial smiles and temporary which wow patients, then this is the almond material you need. You need white burrs, you need these 2 soft flex discs, you need Gluma, you need Etch, you need the Luxaflow, you need Luxatem BL. So, you know, this is just a quick thing here. Cementation is so important. You know, from my experience and talking to dentists, this is the bit they find stressful. My last patient this afternoon was a 2.5-hour fitting, complex case. It was a narrow smile. We did a wider smile, so all the restorations were thicker. And we had to use varilingual dual cure cement. So how did I use rubber dam? How did I control everything? The gums were perfect. And how do we? So on my Veneers by Ash course, we do a whole demonstration on veneer fitting live. I'll give the lecture. I'll show you exactly what we do step by step as well. But my favorite cement by far is Verilink. You need to buy two kits. You need the LC light cured kit and you need the dual cure kit. My favorite color, 9 times out of 10, is light. Sometimes I might use neutral. For a really older patient, I may use warm. They're also bringing out new colors soon as well. Gum health is so important, whether you're doing composite bonding or porcelain veneers. We have the EMS system in our practice and the airflow machines used by hygienists and therapists. This has revolutionized the periodontal care. We have 1 hour sessions in our practice. And, you know, this is really something you have to consider strongly if you want superb gum health. The best tip on this webinar is this one, this mouthwash, Ultradex. I was introduced to this by the brilliant dentist Mervyn Droon many, many years ago. I've been using this mouthwash myself as a dentist, as a patient for 20 plus years. It's vegan friendly, alcohol free. The active ingredient in it is chlorine dioxide. And if you want scientific research, there's about 9 or 10 articles. Go to ultradex.co.uk. When I've made my LuxTemp trial smile and the temperatures are linked, they can't floss, I give my patient a big bottle of this mouthwash. You must have these bottles of mouthwash in your practice. They're not going to go to Tesco, they'll forget. So give them the bottle of mouthwash, and I tell the patient, rinse with each day, twice a day, for 2 minutes in the morning, 2 minutes at night. And even though they can't floss, by the time we take the temperatures away, there'll be no bleeding at all. Electric toothbrush, this mouthwash, and the Easy Pick orange little brushes, if you can, that'll be amazing. Okay, so tip number 9, pick your laboratory ceramist carefully, guys. I mean, if you want all these fantastic smiles you see people posting on Instagram, then really you cannot use average technicians or people who don't know what they're talking about, right? I'm humbled to be working with this gentleman. His name is Rob Storer. In my opinion, he's one of the finest ceramist technicians in the UK. He's over 40 years of experience. He's based in Basildon. We've traveled back and forth to America, learning from the best clinicians and the best ceramist technicians in the world. And his lab called Amdec Dental is specializing in smile makeovers. He understands occlusion inside out, and he understands my mind inside out. So together we have evolved systems which are just absolutely perfect for smile makeovers. So his support and work is superb. Okay. And it's really artistry, you know, to do all this work is really beautiful art. And, you know, to get nice work like this takes a lot of effort. So we should be humbled by all the hard work that the technicians do. If you need to charge the patients more, then do it, but use good laboratories so you get beautiful work. As an example, this is a case I was treated on my 8-day course. This patient was a young lady. She had gaps between her teeth. We did mock-ups. Then we did veneer preps with the Gallic-Gorel technique. Very minimum preps, almost no drilling on the teeth at all. No local anesthetic was given for the, I think we did 8 or 10 veneers. That's before, that's after. Notice there's some more texture. Look at the color gradation. She wanted a natural smile. And you can see that these are veneers with a lot of artistic elements here. This is what went into making these veneers. It's not just like something that's churned out from the syrup machine. There's some warmth here. Look at these edge effects, the way the shape is. Look at the halo. Look at the little bits of translucency, different colors inside, power bleach, the different enamels. You know, there's a lot of skill and science and art involved in creating work like this. Okay. Final tip, number 10, is occlusion. You want your treatment to last a long time. For me, it's great. I've got patients now coming back to me after 20 years. I did smiles makeovers 18, 19, 20 years ago. They're now tracking me down and coming back to me for checkups. And it's just amazing that the veneers, everything's still going strong. Maybe they've had some gum problems, some bone loss. But really, veneers, if they're done properly and they're bonded to enamel, they've got a 98% success rate after 12 years. Research done by Gallic-Gorel in 2013 shows that. However, you have to be very, very good with occlusion to make your things last a long time. Few really great tips for you. There's something called a 2-phase articulation paper system. I've been using this 2 papers for 20 plus years. The best papers to get are by Bausch. You want this one called Progress 100. It's a thicker paper with transvulase bonding agent in there. So I use that first. And then I use RT foil, about 12 microns thick, the double-sided red thin paper. So what you're going to get is a blue circle, then a little clear bit, and a little red dot. So from a visual analysis point of view, this is like a bullseye. I know where to go for. So this is a great, great tip for you. The second best tip I can share with you with occlusion is record your pre-op shim stop hold for every single patient from now on in. Whether you're doing a filling, a crown, a 3-unit bridge, 8 porcelain veneers, write down where the shim stop is locking on an area where you're not working. And then when you've done your filling, make sure the shim stop's locking before they go home. If you fitted your 1 zirconia crown, make sure it's locking. If you fitted your 8 veneers, make sure you're back in centric occlusion, okay? This is a basic tip. Write your shim stop hold down on the lab docket and make sure the technicians, when they articulate, they actually check that the shim stop is holding before they send the crown back. This tip will save you so much time clinically, not having to adjust crowns too much. I'm a big advocate for this thing called tech scan. The whole world of dentistry is going digital. And for me, it's sad that most dentists, then don't finish the cases off digitally. The T-scan, or the tech scan, is the best occlusion software system in the world. It does 2 things which articulating papers cannot do. All right, they cannot do. And articulating papers, all these marks here, right? No one, including me, would know which of these paper marks is a higher force, which is the highest force. The second thing, none of us can tell which contact came first. Was it this one, then that one, then that one, that one? Robert Kirstein, who's my mentor in occlusion, is the best digital occlusion teacher, and in my opinion, the best occlusion teacher in the world, right? He's done plenty of research, and the research shows, and this is disheartening, get ready for it, 80% of the time, dentists make the wrong marks, wrong adjustments. You cannot tell without digital occlusion. Here, I can tell the force marks. So I cannot use T-scan on its own. I then need to go back to my papers and correlate. If that thing is that one, that could be the one I need to adjust, okay? So think of T-scan as like your sat-nav. It's like your sat-nav in occlusion, yeah? So that was a sort of brief 10 tips in terms of learning. I've literally just shown you the tip of the iceberg. But to conclude, the reason I've got to where I am, really, honestly, is because I've invested in myself as a dentist in learning from the best, okay? And going forward now, if you're interested in the smile makers and the type of work that I'm trying to share with you, then you may say, okay, that's a fantastic webinar. Let me just put into play everything that Ash has shown. You can go and do it on your own. But what will definitely happen is you'll end up with frustrations, things going wrong, and the self-learning thing, you go back to your comfort zone and not do this type of work. So you have 2 options now going forward. You can either try and make it on your own without any help, or you can let someone like myself help you. And any dentist that comes in my academy, my goal is to help them become not only fantastic dentists, but to increase their income generation opportunity. So it's not unheard of dentists easily earning over 20,000 take home a month, okay? So if that's what you want, if that's what you want to consider and learning the best of everything I've learned in 30 years, then take advantage. I spent nearly $250,000 in my 20 years of postgraduate education, back and forth to America, learning from the very, very best teachers in the world. Okay? And if you want a fast-track way of learning, step by step, then that's exactly what I do. On my 2-day Veneers by Ash course, you will prepare 8 veneers with my personal advice and help and guidance. And what this will do is that you will not only improve your knowledge. Everything I teach is based with a lot of scientific evidence. And there's a lot of knowledge. And you will also gain your confidence. That's what you need. You need to improve your confidence so you can do this type of work. And then you can start treating bigger cases as well yourself, rather than keep referring these cases out. And my biggest goal is to learn from my mistakes. I've made about every single mistake you can make in cosmetic dentistry, and I share these in my courses so that you can avoid these mistakes as well. And my goal is to create world-class, healthy, and beautiful smiles. Not just smiles that look good, but I want them to be very long-lasting without breakages and expensive remakes. These are some of my mentors. As I've said to you, these are the best people in the world. I mean, Frank Spear, David Ornbrook, Robert Kirstein, Bill Blatchford, Kathy Jameson, best business coaches in the USA, Bill Tatum, the father of implants. My cosmetic dentistry journey started with Larry Rosenthal, Christian Coachman, Dalip Gorel. These are all the people that I look up to that have shared knowledge with me. This Friday and Saturday, I'm doing my Veneers by Ash course. It's in London. It's a phenomenal venue. It's the hands-on course, in my opinion, if you want to do smile makeover dentistry. My style of teaching is inspirational and step-by-step, making complex subjects easy to understand. I want, as I said to you, if you go on holiday or come to practice, I want the whole experience and learning on this course to be phenomenal. So not only will you enjoy great learning of dentistry, this is a vegan restaurant that has got unbelievable food. So you'll be really well looked after for the 2 days, okay? And I'm humbled that some of the best dentists have come on my courses. Rona has been on my 8-day course. I've then gone ahead and mentored 2 big wear cases in a practice in Chelsea. And for me, you know, many years ago, she referred her mother to me. I did her upper and lower veneers. So for me, you know, it's humbling that top dentists see that the way I'm doing things is perhaps a good way. There are a lot of testimonials on my website. This is for my 2-day course. So there's a lot of video testimonials, a lot of detailed testimonials. Go and check out online. When you pick a teacher, you have to check their credentials, but you also have to see what people have got to say about them. So the 2-day Veneers by Ash course, some of you may have been on it. It's a world-class course. There's high definition video training, a step-by-step. Over the 2 days, we go through everything in a lot of detail. You're going to take all the records on each other. So I'll teach you every step what to do. And there's a cementation masterclass demonstration on day 2. So you will leave that course knowing 100% how to fit 8 to 10 veneers in a confident way without making mistakes. All right. The course book is thick. You've got so much information and scientific studies in there. And we'll go through lasers, we'll go through T-scan, live demonstration. I'll go through a lot of case selection, who to treat, who not to treat. I'll give you more of an insight into the full examination I do. We'll go through a lot of depth about occlusion. I'll do a treatment planning exercise on a rare case, so you know how to treat rare cases as well. We'll go through a lot of salient tips on photography, so you become superb at that. I'll talk to you a lot of detail about all the different smiles. Natural smile, glamorous smile, white smile, made in Turkey look. You need to understand what goes into every single one of them so that you communicate properly with your technician. I'll show you how to do the trial smile review in detail and what to do. You'll understand exactly how I treatment plan, and shade matching is so important. My ceramist technician, Rob, comes to the course and he does a beautiful presentation on the artistic, the lab side of things as well. Obviously, you do the veneer preps. Each and every dentist will learn so much just by doing their 8 veneer preps. And then we'll talk about the communication, how to do cementation, the after review, talk about mistakes. I'll show case after case after case. We'll go through a lot more detail about how I market the practice. And then obviously selling, I've shown you a little introduction today. We'll go into a lot more detail. Everything is provided on the course. You just bring your loops along and you will learn how to go from here to here in only 2 days. And the best thing from my point of view is anyone that comes on my courses, they become part of my friendship, my club, and I'm going to help them ongoing. If they then one day want to buy their own practice, they want to have some fundamental questions, you know, I'm just a phone call away. If you've got some bigger case you want to do, WhatsApp me the pictures, I'm going to guide you through that, okay? So to summarize, what are the benefits of doing this type of bigger case in smile makeovers, right? Firstly, it's professionally and emotionally really satisfying. Today, 33 years on in, you can still sense that I'm passionate about what I do and I love going to work. And then financially, you're going to do really well. This is the highest turnover type of dentistry there is. More importantly, you're going to change people's lives forever. The guy that I fitted the veneers today, right? For a 49-year-old guy, he walked in first and he burst into tears. He's so messed up with his smile. He said, I'm in control with every facet of my life, but I'm so embarrassed with my smile. When I did the mock-ups and I showed him the mirror, That's the second time he burst into tears. So this is what we are doing. We are doing life-changing dentistry. But I think what's really important is how we want to change your lifestyle. I want you to think about your why. Think deeper. I told you about your vision, your goals. So for me today, I get up early in the morning. I normally wake up 4:30. So I'll do my meditation or chanting for 2 hours in the morning. So I'm focused spiritually, mentally. I'll then go to David Lloyd, which is around the corner. It's a world-class gym. The spa is like much better than any hotel, so I can be relaxed. I turn left. I'm at the practice in 2 minutes. This is the type of practice I work at. I have a fantastic team. And then the family support. I'm really blessed. My wife Jyoti does so much in my academy and helps me. My kids are growing well. This is my daughter, who's now 50th final year student. And Thursdays I take off. So Thursday normally I go and play golf in the morning. Weekends I keep free. And for me, spiritual progress is so important. This gentleman is one of the most important people in my life. He's a guy called Keshav Swami. He's a monk that is sharing wisdom all around the world, and is someone who I aspire to, someone who I'm serving a lot. And by having that inner fulfillment and discovering that happiness comes from within is what's going to really make you successful. Money will not give you happiness. Having material things will not really give you happiness. Having that inner fulfillment will, okay? So, thank you for coming on this webinar. As a thank you for Portman Dentists, okay, my next Veneers by Ash course is on the 21st and 22nd of March, 2025, okay? And really, the investment for this course is $1,750 plus VAT. So as a thank you for anyone coming from Portman, just remember this promo code, SMILE250, SMILE250. So if you go online and book on this course, then really your is costing you maybe the equivalent of £2 fees. But what I'm teaching in return is a lifetime strategy of doing these smile makeover techniques, okay? So for the first 4 dentists that register and sign up for my Veneers by Ash course, either the March one or the June one, whatever, if you put this code in, I'll let you have £250 off the booking. So that's my website. It's theacademy.ash.co.uk. I've gone 2 minutes over, Asad, so thank you. It's been really great sharing some tips and knowledge with you. I'm going to stop sharing my presentation now. So, yeah, over to you, Mr. Asad. If there's questions, you can call them out and I'll answer them.
Well, firstly, incredible. Thank you so much, Ash. I'm sure everyone at home's learned so much. It's been incredible for me. My key, I've been making some notes. My key kind of thing that I took away was be interested, not interesting. And, the building relationship part is so important in dentistry. But even in our personal lives, for example, as you touched on at the end, how can we get that satisfaction, fulfillment in our lives? I mean, well, thank you again for sharing all your tips. And you're one of the most generous people in dentistry, not just with your time, but with your tips. So I'm sure everyone took a lot away from that. So questions, we've got questions coming in, and if anyone else still has questions, then please feel free to add them. First question from anonymous attendee: what's the best way to mask a dark tooth with a veneer?
Great question. If you have a single dark tooth, which we all have, if someone's had trauma when they're young, their root canal treatment, the tooth goes dark, they keep patching out with composite. The minute they're 19, 20 now, they're really embarrassed. They want a boyfriend, they want a new smile, okay? So the first tip is you need to prepare more heavily, okay? So normally your veneer prep should be 0.5 millimeters depth. Here you need at least 1 millimeter. So it's really important to give the technician hope to mask that with the opaquing of the ceramic and then do the layering of the Emax on top. So if you don't prep correctly, you are in trouble straight away, okay? The second thing is you have putty indices made from the wax up. So once I've done my prep, I'm checking with the incisor ledge putty index and the labial putty index to actually check how much space I've left the technician. The third tip is before you take your master impression or digital scan, you can actually just make a quick temp reassad with your Luxatemp and your putty index. And if the color is still showing through, then you're not prepped enough maybe. So if you got enough thickness of material, 1.1, 1.2 millimeters, a little bit more, then I think you'll be fine. Fourth thing, you take a stump shade photograph. So you have the ND stump shade guides. This is the natural dye shade guide from Ivoclar, and it's got ND1, ND2, ND3, 4, 5, 6. So whichever is the closest stump, like ND6, ND7, the darker stump, you take lovely photographs with a black background, and then you send all that information to the technician. And then you also get the patient to go to the ceramics technician or let them choose a color properly. And then you need a superb technician who really knows what they're talking about. So you need all of this to come together, and probably a technician to make you 2 veneers on the day. So on the day you come in, you try one in. If it's not perfect, the second one should be perfect. And then you got like an 80–85% chance on that day you'll be fitting something in. Otherwise, you're in trouble.
Yeah, I mean, everyone talks a lot. I mean, that's one of the hardest things in dentistry, really, isn't it?
Yeah.
If you're trying to match a single tooth.
Yeah.
So
it makes a root filled tooth.
Yeah.
Going, even if it's into denting, don't worry. As long as you got beautiful prep, smooth margins, nice, things, soft flexes, all there's no sharp edges and things. You have a nice prep, good axial surface for bonding. You need to give the technician room. That's my biggest tip. Yeah.
Yeah. Brilliant. Thank you. Next question from Afif Hadi, who's just been accepted into dental school, so we'll be starting in September. You mentioned objection handling and hot buttons earlier on, Ash. Did you have much sales training in your early days as a clinician?
100%, my friend. So selling is an art, okay? And you can learn from a lot of people. The person that taught me about sales is a guy called Bill Blatchford. So 20+ years ago, I invested £35,000 in this guy as a coach, and he came here twice, 2 days at a time, and he had a 1-hour conference call with me once a month for 12 months. So 12 1-hour sessions and a couple of visits for 2 days, 35 grand. 20 years ago. Remember, it's a lot of money. We were the first in the UK to be coached by him. This guy had read 200 books on selling. He's a dentist and a business coach. 200 books on selling. And since you asked me nicely, Afif, I'm now going to give you the best book on selling in dentistry. Okay, so if you write this down, everyone, it's called Integrity Selling for the 21st Century. I'll repeat that. Integrity Selling for the 21st Century. The author is called Ron Willingham. Okay, this is your Bible of sales. There are 19 people left on this webinar. I think Amazon will have 19 sales of this book today. If you want to really master the art of selling, fast track, then read this book and then come and thank me in a year's time from there. Okay. But there's a lot to it, my friend. I'm just giving you a quick 1 minute answer to your thing. Yeah, carry on.
Fantastic. Yeah, I've heard that story from you firsthand. It's an amazing story how you managed to get in touch with that mentor.
Yeah.
Another question a bit about business skills again. You aren't taught any business skills at dental school. How did you go about addressing those gaps as soon as you graduated? So you touched a bit on that. And what advice would you give any younger dentist in that space? So again, you touched on that.
Very good question. So these days, I think to buy new practice, I mean, let's just say you had a rich father and he said, okay, son, you come out of dental school, next year, let's buy you a practice. I wouldn't rush into it, but there's so much to learn first, guys. So some tips on how to become better at business. Number one, read more, read around the subject more. Read people who have been successful. Read Steve Jobs' book. Read Richard Branson's book. Get some tips from entrepreneurs. The second thing is read a magazine like Private Dentistry. This is the only subscription magazine, but it's phenomenal. It's packed with lots of great articles and tips on successful practices and communication and clinical and everything. So definitely subscribe to Private Dentistry magazine. The third thing is, if you come on my course, you're going to learn a lot. So pick your mentors. I mean, there's other coaches and people in the UK as well that really share brilliant knowledge on business and communication stuff. So as I said earlier on, you have to invest in yourself. It's not just you're not going to end up on your lap just becoming a great business person. And you learn by mistakes, guys. Okay. So don't be scared of making mistakes. Success is built on failure. But before I had 3 practices, and then when I set up Smart Design by Ash 15 years ago, because of all my experience, My goal this time was to create the practice of my dreams and not really make any mistakes. And that's you learn from experience. So by being mentored or becoming friends or talk to successful people in dentistry, you will gain so much business skills as well. So yeah, these are some quick things, but read some nice material. Just go to Waterstones, buy some books, start reading around different things in business and selling and communication. And there's so much out there. There's so much out there. And the thing, you've got to develop yourself in all ways, not just teeth and fillings and crowns and things like that. Develop yourself all around. That's my tip for you.
Fantastic. Yeah, I mean, so much information available nowadays, kind of on our fingertips. Another question, are there any educational social media accounts you would recommend following?
Educational social media accounts. Okay, I think YouTube is really good. I mean, if you want to find out anything, you go on YouTube these days, you'll be a video explaining the whole damn thing the way it's done. So I'd say rather than social media, YouTube's very good. Social media, I think we're all using more for marketing reasons. That's the bottom line. If you look at Rona, the beautiful job she's doing, she's selling a lifestyle. She's attracting patients from Instagram big time. So again, it's back to your, but yeah, I mean, if you go on my Instagram account at Ash Parmar Dentist and you look back at every single post, I guarantee you there'll be some gems in there. There'll be lots of tips I've shared, or you pick up 30 different things just by actually bothering to go through my Instagram account properly and think, okay, that makes sense. That's why I did that. That's why I did that. You understand? So yeah, any good clinical educator out there, don't just on Instagram, what we're doing these days, life is too, we haven't got time. Everyone's just like flicking through things, right? But go and study things properly if you want to get good. So yes, follow the big dental educators on their Instagram. There'll be some cool things. Go on their websites, learn from webinars. By the way, this is a webinar series. I said this is the first one. PortmanDentex have done a great job. There's a fantastic topic once a week. You can come to these 6 webinars and you're going to learn so much literally just by sitting from your home in the evening. So there's plenty of ways of learning, guys.
Yes, there definitely is. I mean, thank you, Ash. I mean, you've plugged the future webinars for us, and yeah, I mean, would love everyone to continue to attend those. So I think, I mean, we've taken up a lot of your time. So sorry, that's my son in the background just coughing there. Final question for tonight: why do porcelain veneers come off, but the bonding stays on?
Good question. So if someone is bruxist or has got heavy occlusal forces, there's a number of things. One is your preparation technique. Like for example, there's a guy, a 76-year-old Greek guy that came as a new patient the other day. All right. His dentist couldn't do anything. He's got really strong teeth. His upper 6 teeth are right down to the gum level, right? And there's like 1 millimeter tooth left above the gum level. Solid bone. You can see the little circles of the nerves almost within a year or two going to come through. Wear everywhere. Do you understand? Now, in his case, if I wanted to restore those, I need surgical crown lengthening first, elective endodontics, cast posts, crowns. So you must have retention. You need to follow the basic design principles of preps. You need to become superb at occlusion, right? Your cementation technique has to be perfect. And you need to have access to equipment like T-scan. So a mixture of all these things, like good clinical technique, mastery of occlusion. I've got a lot of patients who are bruxists, who have delivered and are given a dual laminate mouth guard at the end of the process made from S4S. And some people will wear it, some Assad won't wear it, right? But touch wood, it's rare that I get things breaking and coming off. I really don't want that because it's just a headache. It could be Thursday afternoon, Friday, Sunday, you fitted the veneers come off. So for the question that's being asked, there's a whole multiple number of reasons: lack of clinical skills, occlusion skills, bonding systems, wrong cement being used. Even to fit veneers, there could be like 40 different small steps. You miss 2 of those steps out and you're going to get failure. So it's a very good question, but the answer to that is more detailed and you need more and more education to become good at that.
Fantastic. Okay. Well, thank you again, Ash. Thank you everyone for joining. We'll call it a night there. and we look forward to seeing you all again next week. Thank you.
Great. Thank you to the Portman team. Asad, thank you. Lisanne, everyone, thank you for your help in organizing this, and I
My
do appreciate it.
pleasure.
All the best. Bye.
Thanks again. Bye, everyone. Bye.